It's not just how much you smoke, but how long you've smoked for. Same thing. What's your cholesterol? How high is your cholesterol, and how high has it been for how long? That's critically important. So there's this rare genetic condition, this PCSK9, affecting the rare lucky individual where they have lifelong LDLs, not that low, but they have it for their entire lives and have dramatically lower cardiovascular disease rates.
This is Doctor Talks.
Hey, welcome everybody. I'm so glad you're joining us on this, reversing cardiovascular disease, reversing heart disease summit. It's so critical that people get this information. And today, I'm excited to have with us Dr. Michael Greger, one of the heroes in this plant-based movement and a friend of mine, and so respect the work he does. It's so terrific to have him join us today. So here he is, Michael Greger. And let me just give you a brief bio of Dr. Greger for a minute, and then we'll get started with his wisdom. And that is, Dr. Greger has been a founding member of the fellow of the American College of Lifestyle Medicine. So way back, 30 years ago, when all this stuff was started, he was one of those people, as I was too, actually. And then he's a physician and internationally recognized speaker on nutrition and nutritional science. And his science-based nonprofit, nutritionfacts.org, is a free online portal hosting more than 2,000 videos where you can get information on almost any subject related to nutrition and health science. He's presented at the Conference of World Affairs at the World Bank. He's testified before Congress. He is an expert witness in Oprah Winfrey's defense trial on the infamous meat defamation trial. And now he's also an acclaimed author, a best-selling book. His best-selling How Not to Die and the How Not to Die cookbook were huge bestsellers. And then the How Not to Diet book became an instant bestseller too, which we're so proud of him and grateful for his work. And remarkably, all of Dr. Greger's, all these proceeds that he receives from his books and speakings are donated to charity. So he's just an incredibly powerful individual, putting forth goodwill and good vibes out to the world, trying to make the world a better place. So welcome, Dr. Greger. There you are, exercising as usual.
Thank you so much. I'm honored to be here and so excited that you're doing the summit.
Great. And we're talking about heart disease and how not to die, so to speak, right? That's what we're talking about, because the number one cause of death for adult Americans is heart disease and strokes. So let's start with, is it just aging, or is it a longer time of eating unhealthfully that causes heart disease and strokes? Or you're just inevitably going to get heart disease as you age? What do you think?
Yeah, so that's what we used to think. We used to think that for high blood pressure, we used to think that for heart disease, until we started looking around the world and realized that there were populations that did not die of epidemic of heart disease, epidemics of rheumatoid arthritis and osteoporosis and obesity and on down the list. So wait a second, then we have these migration studies that show it's not genetics. When people move and start eating and living like Americans, they start getting sick and dying from American diseases. And so this is a tremendously kind of hopeful approach. And then, of course, it wasn't until people started putting it to the test, like Nathan Pritikin and Dean Ornish, who published the famous lifestyle heart trial in 1990, proving for the first time with something called quantitative angiography that you could indeed reverse heart disease, open up arteries without drugs, without surgery, just a plant-based diet and lifestyle program.
Right. So it's reverse heart disease, but we can also stop people from having like a clot that can propagate and cause a heart attack or cause a stroke. And this is not forming clots and the increased ability of the blood to stick together and from just aging us. It's right. It's kind of like it's what they're putting in their mouth.
Absolutely. And so it's not just the level of cholesterol in your blood, but the so-called cholesterol years. Just like we have pack years for smoking, it's not just how much you smoke, but how long you've smoked for. Same thing. What's your cholesterol? How high is your cholesterol, and how high has it been for how long? That's critically important. So there's this rare genetic condition, this PCSK9, affecting the rare lucky individual where they have lifelong LDLs, not that low, but they have it for their entire lives and have dramatically lower cardiovascular disease rates suggesting, and you say, well, wait a second, how could you be walking around with an LDL of 100 and still not get any heart disease? Well, that's because they haven't been accumulating cholesterol in the walls of their arteries their entire lives. Whereas if you've been eating unhealthy, we really want to get your LDL down more like 70 for primary prevention, and then 30 to 50 are really as low as possible for secondary prevention. If you already had a heart attack, already have known heart disease, we want to push those numbers as low as possible.
Right. So I think you're saying that there's like a LDL that if you're eating unhealthy, you've got to push it down higher. If you're eating healthy, it doesn't have to go down as far. But wouldn't you think that like a statin lowered LDL is not going to be as protective, generally speaking, as a dietary and lifestyle lowered LDL? Right.
Well, the reason is because there's this panoply of benefits of eating healthy beyond just what the statin offers. Now, the statin is not just cholesterol lowering, but it has an anti-inflammatory effect. But you look at a diet and exercise, look at healthy eating, and there is this long list of benefits, like the blood rheology, which you talked about, the flowability of one's blood, lowering blood pressure. Statins don't do anything for blood pressures. Lowering excess blood sugar levels. Statins actually increase the rates of type 2 diabetes, whereas a healthy diet, the same healthy diet that can prevent and reverse heart disease, can prevent and reverse type 2 diabetes. And so on down the list, anti-inflammatory diet. And so you only get a narrow spectrum of benefits when you're taking these lifestyle drugs, as opposed to treating the underlying cause of the disease. If you look at the absolute risk reduction, even in a secondary prevention scenario where someone already has heart disease, we're really only talking about a 2% absolute risk reduction over a period of maybe 6 years, dropping one's risk of a subsequent heart attack from 6% down to 4%. Big Pharma likes to advertise that as a 33% drop in heart disease rates, which is true technically, but it is just that 2% drop. So about 1 in 50 benefit, 98% of people during that time frame would not be benefiting from these drugs. And so look, if you are unwilling or unable to change your diet and lifestyle, these drugs can be life-saving, particularly on a population scale. But for the individual, they're really quite impotent, and we overestimate the efficacy, both patients and physicians alike.
Right. So that's what this summit's about, to get people really, truly protected. And it means they got to make a radical change in how they're living, of course. So what do you
Unless they've already done it.
Yeah, that's already done it. So let's go on. What do you think are the most important lifestyle changes to, let's say you weren't eating healthfully for the first 60 years of your life, and then you have high blood pressure. So what do you think is the most important changes a person can make as they age now?
Well,
And,
the goal.
and how much can they reduce once they're 60 and they've eaten unhealthy? How much can they reduce their risk? And what should they
Yeah,
do to?
yeah. I mean, so first of all, it's important to note that, for example, in Orange's Lifestyle Heart Trial, these were people already in their 60s. They've been eating these terrible diets their entire lives, and yet still able to reverse this accumulation of plaque, even late in life after a lifetime disease. So it's never too late to start eating healthier, to start moving, to stop smoking. We really do have the power. Unfortunately, of course, the number one way most people, a slight majority of people, die from heart disease, something called sudden cardiac death, meaning you don't even know you have heart disease, and then all of a sudden you're dead within a few hours of showing symptoms. And so that's why you can't just wait until you're diagnosed with heart disease to clean up your diet and lifestyle, because an ounce of prevention is worth way more than a pound of cure, since there is no cure for dead.
Right. I always say the food doesn't taste that great once you're in the coffin.
It's exactly. Taste buds just don't quite work as well. Exactly. So, in terms of if we really were to prioritize, according to the Global Burden of Disease study, sodium reduction would probably be the number one thing, just because salt contributes to mortality for so many different ways: high blood pressure, stroke, kidney failure, heart failure, etc. So, reducing sodium consumption, which predominantly really is about reducing the consumption of processed foods in the United States.
Wow. Okay. So after sodium consumption reduction, you take the sodium out of your diet, you cut the processed foods out. Then what food should they focus on to facilitate this reversal of heart disease? What are the foods you want them to focus on the most?
All right, so yeah, so in terms of the things we want people to cut down on, we want to cut people cut down on sodium primarily. Well, I would used to say trans fats, although trans fats thankfully have been removed from the U.S. food supply. But if you have people on this summit internationally, there still may be these partially hydrogenated oils in their food systems, which they should avoid. But with trans fats largely out of the way, at least industrially produced trans fat, saturated fat would be the next, predominantly found in meat, dairy, but also these tropical oils like palm kernel oil, palm oil, coconut oil. These are not healthy oils. These are these rare, highly saturated plant fats found in a lot of vegan junk foods, which people really need to reduce. And the third thing would be dietary cholesterol, concentrated mostly in eggs. That I encourage people to drop from their diet as well. In terms of flipping to the positive side, we'd like people to be centering their diets around whole unprocessed plant foods. So fruits, vegetables, whole grains, legumes, beans, split peas, chickpeas, lentils, nuts and seeds, mushrooms, herbs and spices, basically real food that grows out of the ground from fields, not factories. Those are our healthiest choices.
Yeah, how does the advertising in America and brainwashing people, how did they get people to think that eggs are healthy for the heart? And the egg yolk, right, is the most cholesterol concentrated food. And they've convinced people to think, oh, cholesterol's not going to hurt you if you eat it, only if you eat
Unbelievable.
saturated fat. It's unbelievable because isn't cholesterol, doesn't it distort the insulin receptors and make you more insulin resistant,
Oh my
increase
God, so much. On
right?
down the list. On down the list. Well, how do they do it? Because they have this checkoff program. Every single egg sold, they need to send money into a fund which is operated by the federal government that goes into general egg advertising, like the Egg Nutrition Center. And so they have tens of millions of dollars every year to pump out this message. So it's the same reason, some way that Coca-Cola tries to muddy the waters in terms of sugary beverage consumption. Basically, all these, I mean, there's just that's where the money is. And so they're able to really push out their message despite the overwhelming consensus in the peer reviewed medical literature.
Right. So, okay, so then if you're there's the medications that doctors use, which as we get older, where they're having some people who, doctors have to wean people off medications, and are some medication more harmful for the elderly, that their doctors are using and more critical to come off the medications?
Oh my God,
Medications
there's
like
a
more
yeah.
medications like doing more harm than good even?
Well, there's this epidemic of polypharmacy in terms of the number of drugs that people accumulate over time. And I forget this. I have the stats in the book in terms of the percentage of Americans at different ages on multiple medications and how many. It's really quite shocking how many people are on drugs, and really needs to sit down. Why are we on these drugs? In fact, some of these drugs aren't even indicated for something like the PPIs, proton pump inhibitor drugs like Prilosec, Prevacid. These are drugs they really only have FDA indication for a few weeks maximum, unless you have something like a acid secreting tumor or something. Yet people end up on these drugs for years, increasing the risk for bone loss, increasing the risk of all-cause mortality, on down the list. All drugs have side effects. All drugs have downsides. You only want to be on drugs if the benefits outweigh the risks, and if there's no other alternative, non-pharmacological alternative that can do the same thing or better.
Yeah. Yeah. All right. Well, and what about, you should say, certain testing, certain blood tests, certain markers do you think people should be watching as they get older to protect their heart?
Well, according to the USPSTF, the United Services Preventive Task Force, really the only lab test that you would get regularly to look at heart is cholesterol. So following the LDL cholesterol, actually the recommendation now, first LDL cholesterol taken early in life, just to make sure you don't have this familial hypercholesterolemia. But then at regular intervals, we want to make sure your cholesterol is low. And this is important as well for people who think they're eating healthy diets. And we want to make sure, because heart disease is the number one killer of men and women, as you said, want to make absolutely sure that your changes in diet are actually translating into what we would expect it to be. So just because the average LDL cholesterol of someone in a strictly plant-based diet comes in at about 68, which is right where we want it for primary prevention, it's a bell curve. And some people just, because of genetics or other factors, end up higher and have to just work harder, have even a cleaner diet to shove their cholesterol even lower. So, regardless of your diet, we really should be getting tested. Make sure your cholesterol goes down and stays down.
Right. All right. And of course, eating cholesterol, eating saturated fat. What about animal protein? Does that also in itself, like what about if people go to the lower fat animal products like white meat chicken does that, how does that, what the effect of that?
Yeah, well, I mean, even in so-called white meat chicken, there's still more fat than protein, about 20% fat by calories. So, I mean, a century ago, chicken it could be considered kind of a high protein food and only about 2% fat. But they've been so genetically bred to have excess body fat that is no longer a anywhere near a low fat food. The concern about animal protein is largely about not killer number one, but killer number two, cancer. Animal protein increases risk, increases levels in our blood of what's called insulin-like growth factor 1, a growth promoting, cancer promoting hormone, which at high enough protein levels doesn't matter if you're eating plant versus animal protein, but at recommended protein levels, only the animal protein will actually boost it. You can randomize people to cut animal protein from their diet and their levels fall quite rapidly. You can do the reverse. And so when I think animal protein, I'm more concerned about cancer and longevity than I am about heart disease.
So heart disease more about animal fats, more like heart disease, and animal proteins more like cancer.
Exactly. Exactly. Although, wow, how about neither? Sign me up for neither and try to get your macronutrients from the healthiest foods, which are whole plant foods.
All right. I think that's the message, obviously. All right. Well, thank you everybody for taking part in this. And I hope you found this conversation entertaining and insightful. And if you're a Summit purchaser, stay with us. Stay right here because we're about to dive in a little deeper with Dr. Greg and ask a few more questions. And if you're not, you can click on the button below or the side to access further information. But in either case, thanks for joining us and wishing you, of course, all the best of health and the happiest life possible. Thank you, Dr. Greger, for joining us here. Um, and it's exciting people to make the larger changes in their health and then hopefully, if they're not there already, to make a huge change to disease-proof their body, right?
Love
How
it. I love it. Sign me up. Let's do it.
how how not to die, how not to have a heart attack, right?
That's right.
So, we're getting older and people are feeling, I don't know, what they're not feeling as good. How do they know if they have to worry about their heart? And I think I got the answer from you. I think you're saying is that don't wait till you're feeling something right
Exactly.
now, right? So what do you think about what could you say to help motivate people to get the fat off their body, start to get off the chair like you are, and start to make a radical change in their diet? So let's see what you have to say about just pushing people to make these more significant changes.
Based on autopsy studies of children in the United States who tragically die, 100% of children raised in the Central American diet have what are called fatty streaks building up inside their eyes. That's the first stage of heart disease already by age 10. In their 20s, 60% of these streaks have turned into actual plaques within their coronary arteries.
Well,
60% 20s coronary artery plaques. And so no so this is a long disease. In fact, it's similar with many cancers. So the so-called latency time, the time between a cancer starts and the cancer is actually diagnosed, can be decades long. Colon cancer, about average latency time 50 years. And so this is, I know we're talking about heart disease, but there's a lot of people who, change their lives, start eating healthier and be like, oh, I don't have to worry about colon cancer screening because I eat so healthy. Well, yeah, but the colon cancer might have started in your teens when you weren't eating so healthy. And yes, eating healthier can slow down the doubling time, slow down the growth of that cancer, but still critically important, maybe particularly important to get colon cancer screened. Why? Because you're going to live so long. Right? We end colon cancer screening often at a certain age because look, who cares if you have cancer? You're not going to live that long. You're going to have a heart attack, right? But if you're not going to have a heart attack, if you're going to live long, well, then we really need to snip out any budding tumors. It's even more important to ensure our survival. But yeah, but for heart disease, right, you cannot wait until your first symptom because particularly for women, the first symptom may be your last.
mm,
But the good news is it's reversible. And one of the most amazing things I learned in all my medical training was that within about 15 years of stopping smoking, your lung cancer risk approaches that of a lifelong non-smoker. So it's just so amazing. Like your lungs can clear out all that tar, and eventually it's almost as if you never started smoking at all, right? And every morning of our smoking life, that healing process starts to wham, first cigarette of the day, re-injuring our lungs with every puff, just like we can re-injure our arteries with every bite, when all we had to do all along, the miracle cure, is just stop re-damaging ourselves. Stop re-injuring ourselves. Let our body's natural healing processes bring us back towards health. Sure, you can choose moderation and hit yourself with a smaller hammer, but why beat yourself up at all?
Right. So yeah, because why, I guess the why beat yourself up is because these people become addicted to this self-destructive food that changes the brain. It's just crazy, but we got to get people to understand these concepts. And okay, so the person's getting motivated. They're going to eat better. They're going to make this radical change. So how much time should they put aside each day to exercise?
Well, the most important message is any exercise is better than none. So I don't want, and in fact, the reason why physical activity guidelines really only recommend about 20 or so minutes a day, actually, which has been progressively going down, because I want it to be doable for people, to be approachable. They don't want to scare people away. But the science actually suggests you get increasing benefits in terms of all-cause mortality, up to 90 minutes a day of moderate intensity activity or 45 minutes of vigorous activity. And then maybe it plateaus. We just really don't have studies of people that exercise longer than that, but we know at least it goes up to that point. So that really should be the recommendation. Ideally, we should be getting as much as 90% of moderate intensity activity like brisk walking every day. But again, any amount is better than none. And even studies suggesting 15 minutes a day of walking is associated with a significantly longer lifespan.
Terrific. All right. Well, I think people got an amazing benefit from this. You hit right the most important points. Well, thanks for being here, for being part of the summit. We're so grateful to you being part of it. And everybody, we're so grateful to you being here as well and being part of this community, sharing, learning, and spreading this word of obviously that we can take charge of our health destiny and you don't have to be sick and it happened to you what happens to other Americans. So take care of yourself, take care of your friends, your family, your neighbors, and let's all do this together. All right. Bye, everybody. Thank you, Dr. Greger, again. Thank you so much.
I am honored to be part of anything you're ever doing. Never hesitate to reach out. Keep up the fantastic work.
Thanks so much. Thank you so much. Bye, everybody.
Thank you for tuning in to Dr. Talks. We hope today's episode has enlightened and inspired you on your path to optimal health. Each day is a new opportunity to make choices that empower your well-being. For more insights and strategies, subscribe to our podcast and visit our website, www.drtalks.com. Stay connected, stay healthy, and join us next time on Dr. Talks. Real talks from real doctors on the issues that matter to you most.